Hello again to my channel. In last video we talked about rheumatoid arthritis. If you didn't watch, I will leave the link in description. So let's start. Early diagnosis and treatment are important in managing raw symptoms and preventing long-term joint damage. If you suspect that you may have RA, it is important to speak with a rheumatologist who can perform a physical exam, order imaging tests or blood work, and recommend appropriate treatment options. There are several types of drugs used to treat rheumatoid arthritis, each with its own mechanism of action and potential side effects. Here's an overview of the most commonly used drug classes. 1. Non-steroidal anti-inflammatory drugs. NSAIDs. These drugs, such as ibuprofen or naproxen, help to reduce inflammation and relieve pain, but do not slow the progression of the disease. They are often used as a first-line treatment for mild to moderate RA symptoms. 2. Disease-modifying anti-rheumatic drugs. DMARDs. These drugs are designed to slow or stop the progression of RA by targeting the immune system. They include traditional DMARDs, such as methotrexate or sulfasalazine, and newer biologic DMARDs, such as adalimumab or etanercept. DMARDs may take several weeks or months to take effect, but can provide long-term relief and may reduce the risk of joint damage. 3. Janus kinase JAK inhibitors. These drugs are a newer class of raw medication that work by blocking the action of Janus kinases, enzymes involved in the immune response. They are taken orally and can be effective in reducing inflammation and improving symptoms, but may carry a risk of side effects such as infections or blood clots. The choice of medication will depend on the severity of RA symptoms, the patient's overall health, and other individual factors. It's important to work closely with a rheumatologist to develop a personalized treatment plan and monitor for any potential side effects. When selecting a drug for rheumatoid arthritis RA treatment, several factors should be considered, including 1. Disease severity. The severity of RA symptoms can influence the choice of medication. For mild to moderate symptoms, non-steroidal anti-inflammatory drugs. NSAIDs may be sufficient, while disease-modifying anti-rheumatic drugs. DMARDs and biologic DMARDs are often used for more severe cases. 2. Patient age. Age can be a factor in medication selection, as some drugs may be more appropriate for older or younger patients. For example, traditional DMARDs such as methotrexate may be better tolerated by older patients, while biologic DMARDs may be more effective in younger patients with more severe symptoms. 3. Comorbidities. Patients with other health conditions, such as heart disease, diabetes, or kidney disease, may need to avoid certain medications or be monitored more closely while taking them. Certain DMARDs, such as methotrexate, can affect liver function and may not be appropriate for patients with pre-existing liver disease. 4. Medication side effects. All medications carry potential risks and side effects, and the choice of medication should take into account the potential benefits and risks for the individual patient. For example, biologic DMARDs may increase the risk of infection or certain cancers, while NSAIDs can cause gastrointestinal side effects such as ulcers or bleeding. 5. Patient preferences. Patients may have individual preferences or concerns about medication, such as the method of administration, for example, injection, infusion, oral, frequency of dosing, or cost. It's important to discuss these factors with the patient to develop a personalized treatment plan that addresses their needs and concerns. Ultimately, the choice of medication for RA treatment should be based on a careful consideration of all these factors, as well as ongoing monitoring and adjustment of treatment as needed. A rheumatologist can work with the patient to develop a personalized treatment plan that optimizes their RA management while minimizing potential risks and side effects. Regular follow-up with a healthcare provider is also essential for effective RA management. This allows for monitoring of treatment effectiveness, prevention of complications and side effects, adjustment of treatment as needed, and education and support for the patient. In summary, there are several types of medications available for RA management, including NSAIDs, DMARDs, Biologic DMARDs, and JAK inhibitors. When selecting a medication, it's important to consider various factors and work closely with a healthcare provider. Regular follow-up is essential for effective management of RA. Thank you for watching this lecture on drugs used to treat rheumatoid arthritis.